Hey guys, welcome back to another video. Today I'm going to be talking about tips that I can give you for choosing your preceptorship as a nursing student. So let's get right into it. So the first tip I have is don't specialize in a field when you don't really have the skills to be in that field. So for example, if you're wanting to be an emergency nurse, go into the emergency room. Don't go into the emergency room as a nursing student. The scope of practice for you is so limited. You'll be doing basic stuff, and I feel like for especially a new grad, you want to learn the most basic skills that you want to consolidate them, like wound care. You want to learn how to put in IVs. You want to learn how to hang IV bags. You want to learn how to do a head-to-toe assessment. Doing all these things thoroughly are crucial for the nursing profession, and in order for you to consolidate those, you really got to go into just like a nursing unit, like a med-surg unit, and that way you're not only able to consolidate your skills, you're also able to build the competence you need to work in the emergency room, let's say, to work in the ICU. A lot of these floors, they're specialized for a reason. You need to have those specialized thinking skills. You need to have the education so that you're able to think like a ER nurse. You need to have the confidence to do an assessment. When a person walks in, your assessment is crucial for an ER nurse. And I don't think that a new grad, even a new grad nurse, knows those assessments, doesn't know how to assess someone very thoroughly at that point. I mean, obviously there's definitely some nurses that know more and some nurses that know less, but in general, I can't really think of a situation where someone's actually that confident enough to assess someone that comes into the emergency room. Second tip I would give to a nurse going into their preceptorship is ask a lot of questions. That's something that everyone tells you, right? But I want to go take it a bit further and say you got to ask nurses on your unit, listen, I'm a new grad, I'm doing my preceptorship, please. And you have to really ask them. I've been to many, when I was doing my preceptorship, I went to almost every single nurse that was working on that floor and asked them, hey, do you have a cool skill? Do you have something interesting? Do you have like a wound care that needs like packing? Do you have like an NG insertion? Do you have trach care? Do you have to put in an IV? And all these different skills, like I would ask them, hey, can I please watch you do this? Can I do it? I'll do it for you. I'm fine. I can do it. My patients are doing okay. Obviously, if you're run down or you're super busy, you don't want to be going out of your patient load and just like messing up your whole your day flow. But like, just ask your nurses on the unit if there's anything else that you can do or anything else you can learn from them, and you'd be surprised. I learned so much during my preceptorship just by asking. The third tip I would give to nursing students going into their preceptorship is go onto the unit one day before your preceptorship starts and just look around in the unit. They'll give you a tour when you first start off, of course, but if that nurse has to start the shift, showing you where everything is, it's just another thing that they have to do in the morning. And you don't want to be the new grad that asks a lot of questions as the day is starting. You don't want to be that new that preceptor student that asks so many questions and then messes up their day flow. So you want to build a good relationship with your preceptor, and the best way you can do that is being proactive. I'm sure you have a day off the day before, or you have a few hours the couple days before to go in and just get accustomed to the unit. Just say, hey, I'm a precepting student, I just want to look around in the unit, and speak to your educator. Your educator, if you go on a weekday, they work usually 8 to 4, 9 to 5 kind of jobs, and then you can ask them a whole bunch of questions. What can I do to make my preceptorship here better? What can I do to learn more? What do you recommend? Can you give me a tour? Can you give me pamphlets? What do you often see here, so I can prepare myself going into going into my shifts, you know? Just read up on it. Like, I know that when I went there, my preceptorship talked to me a lot my educator talked to me a lot about how there's a lot of wound care, and there's a lot of like ostomies, and what else did she say? She talked about tube feeds. There's a lot of comorbidities like pneumonia, diabetes, hypertension, you know, and sepsis was huge. So what I did was I just went in a couple days earlier. I learned all these different I refreshed my memory on a whole bunch of different things. So whenever I went into preceptorship, not only did I know the unit, you know, I told my preceptor, hey, I already been here. I know the unit. Don't worry. You don't need to give me a tour. Let's get right into it. Let's start doing the head to toe. Let's doing our safety checks. You know, all these things. A lot. And it went by really, that first day went by really smoothly. And that gave my preceptor a good opinion, good image of me. He's like, hey, this person's on top of things. Like, he knows what he's doing. And that really helped me later on secure a position onto that unit. They saw that I was very proactive and I was very professional. And as a result, I got hired onto that unit. So I would definitely say, you know, starting things and being a little bit proactive is tip number 3. So there you have it, guys. 3 tips I would give to new precepting students, and that's what I would recommend for students going into their preceptorship. I hope you guys enjoyed this video. Please like, comment, and subscribe. Thank you so much. Take care.